We're winning the battle against coronavirus, but our brains are paying the price.
It's okay until you start seeing the numbers start climbing again, and that's when you start having to psych yourself up mentally to come to work.
There's not enough hours in the day for all of the worrying and all of the sleep that I need.
Denver 7 is going 360, multiple perspectives on a pandemic and its aftermath.
Do not have any shame of sharing your story, of sharing your faults, of sharing your flaws. No one's life is perfect.
I'm Shannon Ogden, and I'm glad you took the time to join us. We're going to spend the next 30 minutes talking about the most important crisis of our generation. COVID took the lives of some of our neighbors. It also took away our freedoms, our leisure activities, and forced many of us into an isolation that is just not normal. Depression is up. In fact, 6 times as many people reported the symptoms in 2020 as compared to the year before. Anxiety is up. Half of us reported the symptoms of anxiety last year. And when COVID's gone, the elephant in the room will remain: mental health. We see mental illness as a possible factor when we talk about mass shootings. I think most of us would say that mentally stable people won't kill, and, well, we need to do a better job of spotting the red flags. When we talk about the opioid crisis, we're talking about mental health, obesity, mental health, marijuana dependency, alcohol abuse, mental health. And certainly one of the most visible problems on the Front Range, homelessness, is also one of the most closely tied to mental health. And it's there that we find the most extreme examples. People who could not find answers in the system wound up living outside of it. And it's easy to look at all those things and say, well, that's not me. I drink responsibly. I live in a house. I feel fine. I don't need help. Sometimes that is true. But other times, I feel fine is what you hear from people who need help the most. Even people who played in the Super Bowl next to Peyton Manning. Denver 7's Jessica Porter has Monte Ball's story.
I'm very fortunate and grateful to have been blessed with the abilities to play football.
From the time he played in high school, Monte Ball was special. He graduated from high school in 2009 as the St. Louis area's all-time leader in rushing. He traveled to Wisconsin for college. There, he became larger than life.
That immediate stardom was like a cultural shock in a sense of everywhere you went, felt like people were judging you, staring at you. At times I really felt I couldn't focus in class because people were looking at me or asking me for autographs.
Ball, middle, over the top.
The stats speak for themselves. Ball set the college football record for touchdowns. The Badgers won multiple Big Ten titles. But privately, Ball was struggling.
Obviously, I suffered a lot. It started in college with depression and anxiety. Significant depression, actually, because I paired that with, self-medicating with alcohol. And as we all know, that's a slippery slope. There were many times where my running backs coach at the time, named Thomas Hammock, who would smell it on me that morning of practice, and he would pull me to the side and chat.
You have to understand, now is not the time to be coming to practice hungover. I wanted him to understand, everything that you do matters, both on and off the field. And you may not like me now, but you will thank me later. When he was in the building, he was the hardest working guy in the program, but obviously, he liked to have a good time outside the building.
At the young age of 18 and 19, I really didn't know how to speak on it. I really didn't know who to talk to. I didn't even know that I was suffering from it. You know what I mean?
With the 58th pick in the 2013 NFL draft, the Denver Broncos select Monte.
I say it is in this way as if I packed up my alcoholism in my suitcase and took off to Denver.
Growing up in Wentzville, Missouri, the Denver Broncos were Monte Ball's favorite team. He came to the Mile High City 1 year after Peyton Manning's arrival. The team made the Super Bowl in his rookie season, but Ball was barely a factor.
I had some guys tell me maybe his lifestyle choices were contributing to problems with him being in condition without, throwing him under the bus, but they were saying there was stuff going on.
Years of depression were beginning to take their toll. So was the drinking Monte used to cope.
It's where I became super withdrawn from all my friends. I started drinking about 4 nights out of the week.
He's a grown man, right? And he's got a mind of his own. So I was trying to be more of a support structure for him, as opposed to, trying to tell him, hey, you shouldn't be doing this. And I think, because they can shut you out. And I never wanted him to shut me out.
Monte opened the 2014 season as the Broncos starter. He got hurt 5 weeks into the season. It would be the end of his time in Denver.
When Denver released me, I actually had a conversation with Elway, prior to me packing up my locker and leaving. And he shared with me that, he's kind of heard around town that I like to party and I like to party hard. And he's not lying. He wasn't lying at all.
A brief stint with the Patriots came to an abrupt halt in February 2016. That month, Ball was arrested in Wisconsin for felony domestic abuse. A police report says he threw a woman into a table, causing her to injure her leg and her head. When she found out Ball was in jail, she broke down in tears. She told police she never meant to get him into trouble, but she understood why. It wasn't the first time he hit her.
I literally was on rock bottom, that being my feet standing on the floor of the concrete floor of jail. And I told myself, how do I go from a 2nd-round draft pick, decent grades in school? I was no straight A student, but obviously I did enough.
Monte watched the Denver Broncos win Super Bowl 50 from a jail in Dane County, Wisconsin.
That really showed me, okay, this cannot go with me into my future. I cannot be drinking moving past this point, because that is not the Monte that I even know.
He found out he would become a father on February 16th, 2016. He says it is the day he entered recovery.
I want for him to understand that his father's not perfect, that his father has made mistakes, and that his father is a recovering alcoholic. And I also want him to know that if he ever comes across a situation that he's confused about, that he can feel comfortable coming in and talking to me about it.
Monte is talking about mental health. He's launched a podcast, Untapped K.
So what is it that you do today that is different from what you used to do when you were using?
Through Wisconsin Voices for Recovery, Monte works directly with people to improve their mental health and cut down on their substance abuse. And his book will come out in summer 2021.
I'm a firm believer in that football was not supposed to be the end of my journey. Football was just the start of it, to sort of grab everybody's attention and speak on something that impacts every single person in America, on the planet.
One of the things Monte talked to us about was relationships. No one can deal with their depression or their drinking habits alone. And isolation has been a huge issue during the pandemic. 2 in 3 adults say they're experiencing social isolation, and a similar number say their anxiety levels are up. Those are both warning signs for diseases of despair, like suicide or drug overdose.
The opposite of this disease of substance use disorder is a connection to like-minded people on a day-to-day basis. Learning how to share the good, the bad, and everything in between, having those positive humans in your life that are there to support you, to uplift you, to enjoy the good times, but also lift you out of the bad times, is paramount.
James Gannon works in peer support at Swedish Medical Center. He's in recovery himself. The pandemic has not been easy.
I don't want to focus on the bad, but there's been a lot of bad. The struggle is getting people out of that isolation, wanting the help. Unfortunately, we're seeing some people, it's not that they don't have a choice, but it leads them through to the emergency department. That's the amazing piece about being a peer in the emergency department, is that I get that firsthand interaction with them to let them know that there is another way. A lot of times we plant the seed of recovery.
For Monte Ball, support came from family.
Really, it's my brother-in-law. I have to give him credit. His name is RJ. So he's also in recovery as well. He's, I think, going on 8 years, 7 or 8. But and I'm fortunate to have him in recovery. I'm close to him, my father as well. is in recovery, and his father, my brother-in-law's father, is in recovery for like 30 years.
RJ and Monte host the Untapped Keg podcast together. Their guests include football players and recovery experts.
The biggest goal as to why we wanted to do this, outside of obviously helping folks who may be suffering in silence from substance use disorder, is, we just want to spread positivity, man. We see on social media, and obviously you see it as well. It can be very toxic. Mm-hmm. It can be very, very toxic, and especially on Twitter, it just seems like a bunch of adults just yelling at each other. So we wanted to kind of just create this medium where, you just come in judgment free. There's no wrong answers. There's no wrong ideas. There's no, just chat, share your story, share what you're doing, how you're feeling.
Study after study has shown men are less likely than women to seek help for mental health problems. Through his work, Monte is working to change that.
Right.
And also allowing for men to become vulnerable, creating a safe space for men to share maybe some past trauma, share stories of them crying, all the above, just to help tear down that toxic masculinity.
Monte Ball's story is just one of many. Depression, anxiety, and other stressors became much more common during the pandemic. 3 times as many people are reporting symptoms of clinical depression, according to one study that was published in September. 42% of people say they're feeling depressed or anxious, according to a December survey from the CDC. And after the break, we'll pick up the pace on our 360 coverage to show you how all of us are touched by the mental health crisis.
People are really starting to now open up and talk about mental health. Obviously, not everybody, but we're seeing on Twitter, we're seeing on social media this push for mental health, and that's a really, really great thing.
More people are talking about mental health. One proposal would force insurance companies to cover one mental health exam each year. That could become law by 2022. But depression and anxiety aren't going away. And for many of us, long-standing problems are only getting worse.
It's something that we're struggling with because some part of us deep down, something's not right. And when that little kind of feeling is creeping up, we want to do something about it.
No one felt the guttural hate of the coronavirus quite like Asian Americans, who dealt with sneers of Kung flu and often acts of violence. Hate crimes against Asian Americans were up 164% in 2020.
This has been going long before it was captured this year, long before COVID happened. This has been going on for a while with a lot of marginalized communities, so it's not new.
Dr. Jessica C. says it's an important conversation to have, but it's also an exhausting one. Dr. C. recommends taking the time for self-care when news reports become too overwhelming.
If you're in the airplane and the cabin pressure drops and the mask falls down, what do they tell you to do, right? You put the mask on you first before you help others. You can still hold systems and individuals accountable for what's going on, but also prioritize self-care so that you don't burn out.
President Biden signed a law cracking down on hate crimes against Asian Americans. His administration is still looking into the proper response to the Black Lives Matter protests from summer of 2020. We saw the pain of the Black community on full display, demanding change and calling for an end to systemic violence and police brutality.
We're done with it. We're done dying. I'm done dying. I'm done being afraid of bringing nieces and nephews and sons and daughters into this world that aren't allowed to live the lives that they deserve to live.
We're trying to cope with a systemic approach to building this country that included the suppression and oppression of people from the very beginning.
Dr. Marjorie Lewis is a behavioral economist who works in Denver. She gets it. She knows the emotions we saw in America's streets were simmering for generations.
I would say millennials probably have handled it in the healthiest of ways because they share it, they communicate it, and they respond.
Dr. Lewis says it's important to talk, whether that means a mental health professional or just a group of people who see the world the same way you do.
Our capacity to endure and transcend is innate, and there's nothing that anyone can do to take it away.
A community that only wants to be seen as equal is under attack, and it is time to stop.
The LGBTQ community stood side by side with Black Lives Matter during the summer 2020 protests. The two have always overlapped. Early gay rights organizations fought for equality. Many civil rights leaders were members of the LGBTQ community. And both groups are at higher risk for untreated mental health issues.
Black lives matter! Gay lives matter! Gay lives matter!
These communities, we already have heightened incidents of depression, anxiety, suicidality.
The pandemic made things worse. LGBTQ Coloradans were more likely to have their hours cut, or to say their finances were much worse off because of coronavirus. Colorado nonprofit Queer Asterisk is helping people stay connected. They've set up online groups and virtual mental health services.
Lots of queer folks don't have safe homes to be in. So that's something I'm hearing, is that folks aren't out to their roommates or their family. They can't be themselves.
People living in the LGBTQ community are at higher risk for suicide and homelessness.
Sometimes I'm hopeless, but I can't give up. That's not an option.
Denver and other Front Range cities are spending millions to get these people into shelters. But the number of homeless people in our state went up more than 2% in 2020 when the pandemic began. It impacts almost 10,000 people in Colorado.
Between 88 and 90% of the people we survey say that they want housing, they're looking for housing, but are not able to attain it.
Psychiatric Times calls it a never-ending loop. Someone with mental illness becomes homeless. The stress makes things worse. It becomes an impossible spiral. Government resources can help, but there are not enough to go around, and they can be difficult to access.
Apartment buildings boarded up. Well, unboard them, renovate them. Let us help renovate them.
Every day things are happening to the unhoused population, to the poor Black community, to the poor Hispanic community out here.
Some communities are trying to react with compassion. Under Denver's STAR program, mental health professionals now respond to some 911 calls instead of officers.
Where can we get you to that makes you feel safe, that makes you kind of feel like your basic needs are getting met? And if you don't have those, how can we connect you with those?
We know sales are up in dispensaries and liquor stores since the pandemic started, and the data points to a widespread problem. Denver 7's Russell Haythorne brings us 360 perspectives on why.
That moved up to the front.
At Ace's High Spirits in Denver's Northfield neighborhood.
It's a growing neighborhood, and we feel like we've been growing right along with it.
Investor Paul Villela and owner Stephanie Cloven feel fortunate to be in liquor sales.
Our breakthrough order coming in.
At a time of so much uncertainty.
We're lucky being in this industry, and we've got a lot of great sales reps. One of the few businesses that are somewhat recession-proof.
While many restaurants and bars fell on hard times during the pandemic, liquor stores and pot shops soared.
Ace's was an increase year over year of about 30 to 35%.
We saw about 20 to 30% growth.
Jamie Perino owns Elements Dispensary in Boulder and says the pandemic had a net positive effect on them.
Kind of helped legitimize our industry that we are essential and people do need us for medicine.
Thank you.
As time wore on and people were at home more, starting to have sleeping issues, anxiety, they started to turn maybe to marijuana to help alleviate some of that.
And while many experts say alcohol and marijuana can be benign when used responsibly, increased abuse during COVID also magnified a dangerous mental health issue.
The ways most people handle stress, which going out, going to the gym, hanging out with friends, all of that was taken away. And the one thing that people do know how to use remains open. Pot shops, the liquor stores.
And turn to drinking as a way of either self-medicating or kind of coping with this time. How many people were in recovery and lost their job and went back to drinking?
That's what we're taking 360. Why do people turn to drugs and alcohol when they're depressed, anxious, or stressed? Psychologist Dr. Annette Geva at Health One's Behavioral Health and Wellness Center says it starts with the fact that it's easy.
Thank you. It's much more accessible to go to the liquor store or the pot shop. The honest truth is it's also cheaper. So if you think of a therapy session versus a bottle of whatever it is, that's cheaper, right?
And Geva says it's also socially acceptable.
Whereas for some people, going and getting mental health support is stigmatized. It makes them feel weak, it makes them feel wrong, they're not handling it well. Happy hour can start earlier and earlier in the day.
Which can be okay, but not necessarily for addicts.
Alcoholism is a very deceptive and very secret condition.
Dr. Patrick Failing is an addiction psychiatrist at UC Health.
How many more people are drinking alone, are drinking in isolation?
And it's not just alcohol.
There's been about a 30% surge in opioid overdoses from September of 19 to September of 20. We know that detachment and isolation from others plays a role.
Exactly.
That was certainly the case for some, like Fred, as we gauged public opinion.
Maybe a little more alcohol. Sitting at home and you just kind of nothing to do, go to the liquor store, come back home, watch some Netflix.
Many increased their use of liquor, pot, or both.
I probably bought more. I'll do the pen, I'll do dabs, and then I'll smoke the grass. If I smoke, it just helps me calm down.
And yet others, like Mike, used the pandemic as an opportunity to cut back.
Me and my friends were already drinking and smoking a lot before COVID, and so we used it as the opposite, like a little break to get away. I mean, obviously I'm out here riding my bike, you know what I mean, cruising around.
Yeah. And Ashton says the pandemic helped her stay sober. She quit drinking before COVID.
I stopped drinking just for some personal reasons. Through COVID, I was home, so it was easy to just keep not drinking. It was not like I was tempted going out with friends or anything like that.
Unfortunately, not all fared so well. Dr. Failing reminds us to watch for signs with our loved ones and says it's a spectrum disease. It can be mild, moderate, or severe. A high predictor of growing or developing an addiction is often history of another addiction.
These conditions can grow if nobody ever intervenes in any fashion.
And that's the key, according to Dr. Geva, thoughtful and delicate intervention.
What's going on for you? Hitting the underlying problems and not shaming the person for the behavior that is problematic.
Dr. Geva says it's not really the responsibility of liquor stores and pot shops, although both Villela and Perino say they put themselves out there sometimes.
It's not to say our place to step in, but we do have resources that we do like to offer to people.
That was something we had to really think about early on. Over time in these neighborhood stores, become pretty good friends with people.
We appreciate it.
But there are people that we have literally had to say, we're not going to serve you anymore because it becomes a danger.
Bottom line, most experts agree. Hitting up your local dispensary and liquor store on occasion is fine.
We've got a great selection of craft beers, and now the big thing is seltzers.
But going too often could have damaging consequences.
Up next, perspectives from people on the front lines of the pandemic who are ready to unplug from the chaos.
The truth is, money isn't everything. This is a different type than what I thought I was getting myself into.
Amy Skeets is a registered nurse at Denver Health's medical ICU. She's seen it all over the past year plus.
I've been doing a lot more exercising as I could. Alcohol. I do love what I do. And I'm somebody that got into it at the age of 30. So I've been doing this for a lot of years, and it was something that I was passionate about at a later point in my life. And it is something that has really it's very trying.
Most nurses describe their work as a calling. Now, after coronavirus killed hundreds of thousands of people nationwide, many nurses want to leave.
It sounds so nice just to go make coffee and take a step back, honestly.
Bobby Neild is one of them.
I had one friend, her assignment ends here in a couple of weeks, and she got a job at Cold Stone and couldn't be more happier to go and scoop ice cream than work as a nurse right now.
Neild spent nearly 5 years in the profession. He started taking lucrative travel nursing jobs during the pandemic. He also began taking medication for anxiety and seeing a therapist. He says the mental health toll is not worth it.
If COVID didn't happen, I'd still probably be having the same attitude, same work drive and passion that I have, but it's definitely dissipated since then.
We know burnout among healthcare professionals was high prior to the global pandemic, and we were working very hard to mitigate the impact of distress within healthcare prior to COVID.
Denver Health set up its RISE program to slow down the trend. It provides free on-site counseling for anyone on staff who needs it.
We focus on providing just-in-time psychological first aid and emotional support to our staff and personnel who are in distress.
Yeah, I mean, it's a good outlet. It's a good outlet, and it helps. Does it fix everything? No, there's not a cure-all. I mean, yeah, unless you can cure COVID, that would be a cure-all.
Other people became frontline workers during the pandemic almost by accident.
I remember when it first started, feeling bad for the people who were working.
Chelsea Krasowski picked up a job in a King Soopers deli a few months after the pandemic began. She loved being around her coworkers, but the horror stories about angry customers turned out to be true.
Big seller is the Black Forest ham, and we were out of it for weeks. And, people are angry about that. I just work here. I don't package the ham. It's just, when you have one more person that comes in, you might be having a good day, but then someone comes in and just pushes a little too hard, and it really throws off your whole day.
Krasowski was one of the hundreds of thousands of grocery workers hired during the pandemic to keep up with demand. It's an industry known for high turnover, low pay, and unnecessary stress. Krasowski knew she was signing up for that. She did not expect to get caught up in a mass shooting on the job.
A couple of my coworkers and I, when it first started, we'd run upstairs into a storage closet. And then I realized once we were in the closet, there was nowhere for us to go. And I panicked and I ran for my car out the emergency exit that was there.
She spent almost an hour in her car waiting for the shooting to end, waiting for friends like Ricky Olds and Denny Stong to come out of that store safely. Eventually, an officer told her to go.
So seeing those names the next day, I think it really wrecked me when I saw Denny's name on that list, because I can only think that his mom had to have been looking for him, calling him, and I think about my son. And I hate it so much for her. It's so unfair. I don't know that I've been processing it really not well, I guess.
Chelsea still will not shop at King Soopers. She doesn't know when she'll return to work.
Someone drops a pallet in the produce section. Am I going to think I'm hearing gunshots again? Or where are all of my exits? And it's just, I can't get those thoughts out of my head when I think about going back. I'm glad to be able to be home through it all, but I'm also really, really tired.
There are many women out there that feel exactly like Chelsea, tired. Dr. Patricia Westmoreland sees them every day in her role as a psychiatrist and as director of Health One's Women's Unit.
The numbers don't lie. 10% of men reported an increase in mental health challenges during COVID compared to 27% of women. And women were twice as likely to run into problems getting help.
I've applied for workers' compensation for the sake of having access to a therapist in the future. And most of the therapists that I reached out to are not accepting new patients. And so it's been a process of finding someone who is able to see me.
Even though we're not all in the same boat, we're all in the same storm, right?
Dr. Westmoreland says some aspects of the pandemic actually increased women's access to therapy.
So I think that seeing other people get help sort of gives people permission to come in and get help. I also think that the greater availability of and ease with which people can get help due to the pandemic has actually been to our advantage in terms of telepsychiatry and teletherapy. So people are able to, seek out and find a therapist who they can see from the comfort of their living room, you know, when their children are doing school in the next room, or in their bedroom when, you know, their kids are downstairs and they don't actually have to find childcare so that they can leave the home to seek treatment.
Other aspects of the pandemic made life more difficult for women. In some cases, it made life more dangerous.
We've also seen women who have had to remain at home in close contact with people who've been abusive towards them. And because of the stress of the pandemic, those abuses have very often escalated. They've also escalated in response to and in association with all the extra substance use that's been going on during the pandemic.
Before we go, I want to leave you with this. Monte Ball talked to us about the isolation he felt as an NFL star. Amy Skeets told us she felt isolated as an ICU nurse during the height of COVID. And over again, we're hearing this similar story. People felt worse about themselves as they stopped talking to each other. Now, if you don't want to talk to somebody and you can't shake that feeling, well, that's probably a sign it's time to reach out. The Colorado Crisis Line is available to anyone 24/7. That number is 844-493-8255. And if you're dealing with partner abuse, call the National Domestic Violence Hotline. That's 800-799-7233. And if you're looking for local resources, there are several nonprofits that can connect you with a counselor or just someone else who will listen. Youth Scene, Queer Asterisk, Real Talk, and Mental Health Colorado are all right here in our community, helping people every day. Or just pick up the phone, call a friend. Mental illness feeds on isolation, and we certainly have all felt our share of isolation. So let some light in. Let your friends in. It might not be easy, but it'll be worth it.